scope of OT to increase social participation, restricted and repetitive behaviors, play, and leisure. It was a systematic review supported by AOTA's Evidence-Based Practice Project. It was loaned to peer-reviewed scientific literature between 2006 and 2013 and included participants with ASD. 66 articles were included and broken into 4 categories: social skills, social communication, play and leisure, and restricted and repetitive behaviors. For implications, OT should use group social skills training programs. There was limited evidence for specific play and leisure interventions, and OT should use behavioral techniques such as antecedent manipulation and self-management to manage restricted and repetitive behaviors. The affiliations were Ohio State and University of Newcastle. For my second article, the purpose was to determine qualitative research can support evidence-based occupation-focused services for children and youth with ASD and families. It was a qualitative literature search of journals inside and outside OT that yielded 125 journals. It reviewed 110 articles that met inclusion criteria, 79 which were coded by 4 OTs. The implications for practice is that OT should consider the impact on family routines. They should provide coping skills to families and address their needs as well. Occupational profiles should include access to services, routines, and family functioning, and the affiliation was the University of Puget Sound and Children's Therapy Center. My third article is an exploratory analysis of OT goals for children with ASD to understand the relationship between sensory factors and occupation. It examined goals to hypothesize the links between performance and participation. 160 goals from a prior study with parents of 32 children with ASD ages 4 to 8 years old. The original study was a randomized controlled trial, which included children with a diagnosis of ASD, an IQ higher than 65, and sensory integration difficulties. For OT implications, goals with parents are essential. Parents are interested in goals regarding ADLs, play, rest, and sleep. Effective communication with parents is very important. Not all behaviors are sensory related, so we need to use the data to determine which ones are and which ones are not sensory. We should also identify goals that may be related to sensory difficulties, and we should use a comprehensive sensory evaluation. We also need to prioritize goals for areas of challenge, and the affiliation is Boston University and Thomas Jefferson University. My fourth article investigates the extent to which specific sensory processing patterns can relate to aspects of development. A retrospective chart review to collect clinical data was used. 769 potential charts were collected using a query of scheduling and billing software. 471 charts were reviewed to secure 400 records. They included children ages 3 to 6 years, 11 months with ASD. OT can facilitate engagement in social communication. The collaboration between an OT and an SLP can yield optimal results. Sensory processing differentiates the effect of engagement in occupation, and it recognizes sensory patterns. You can decrease the emphasis on skill development and create a context-specific support that can increase communication. The affiliation is University of Kansas Medical Center. My fifth article was to investigate the impact of developmental dyspraxia on play skills on children with ASD. The data presented here were part of a larger prospective case-controlled study. 32 participants between the ages of 5 years and 8 years, 11 months with no comorbidities were used. For implications, children with ASD have practice difficulties that affect the ability to fully participate in play and leisure. Parental questionnaires may not be sensitive enough to indicate client factors, and a comprehensive OT evaluation gives the most in-depth information to increase play and leisure participation. The affiliation was the University of Southern California.
So the second theme is traumatic brain injury. The purpose of the first article was threefold. 1, to update information included in the occupational therapy practice guidelines for adults with traumatic brain injury related to interventions that address visual perceptual functions. 2, to synthesize the literature on interventions. And 3, to guide the direction of future research. The design of the study was a systematic review. The implications for OT practitioners are that OT practitioners often use interventions to address the myriad of visual deficits associated with traumatic brain injury, but have not been tested on people with traumatic brain injuries. The affiliations are Boston University College of Health and Rehab Sciences, and it was published in 2016. The second article for theme 2. The purpose of this article was to assist occupational therapy practitioners in making informed decisions about treatment strategies to improve motor function in clients with traumatic brain injury. The design of this study was a systematic review. The implications for occupational therapy are that more research is needed to clarify the effect of neuroplasticity on motor recovery. Author affiliations are the School of Occupational Therapy, Texas Women's University, and it was published in 2016. Third article for theme 2. The purpose was to explore the experiences of people with moderate to severe after brain injury who have experienced change in financial management independence. The design of the study was a qualitative descriptive study to understand participants' experiences of financial management after brain injury. The participants were included if they had moderate to severe ABI, as indicated by self-report, or must have had an injury 1 year earlier and they were 18 and older. The implications for this intervention was that the intervention should aim to find balance between promoting autonomy and preventing harm from financial management. Author affiliations are St. John's Rehab, Sunnybrook Health Science Center in Toronto, Canada, and published in 2016. This is Article 4 for Theme 2. The purpose of the study was to address the question, what is the evidence for the effectiveness of occupation and activity-based interventions to improve everyday activities and areas of occupation and social participation for people with traumatic brain injury. The design of the study was a systematic review. The implications are that current research evidence supports the continued participation of occupational therapy in multi- and interdisciplinary team-based programs. However, the evidence isn't sufficient enough to determine which specific intervention approach or setting would likely be most beneficial for particular clients in improving occupational performance and social participation. Author affiliations are Rehabilitation Medicine, University of Washington State, and it was published in 2016. Last article for Theme 2. The purpose of this study was to identify, evaluate, and synthesize the literature related to this focus question. What is the evidence that interventions that address cognitive impairments improve occupational performance for people with traumatic brain injury? The design of the study was a systematic review. The implications are occupational therapy interventions using cognitive remediation and strategy instruction approaches should be provided to adults with traumatic brain injury. Author affiliations are Courage Kenny Research Center in Minneapolis. This was published in 2016.
So for theme 3, we had stroke, and the first article, the purpose of the first article was to compare the effects of using the cognitive orientation to daily occupational performance with usual occupational therapy on upper extremity movement, cognitive flexibility, and stroke impact post-stroke 3 months max. The design of this study was a single-blind exploratory RCT. There were 35 participants post-stroke chosen from 2 outpatient therapy locations. The implications for OT is that the co-op has a positive effect on performance and impairment reduction in an early phase. Further research is warranted for generalizability and calling into question the use of impairment-based rehab methods. Affiliations are the University of Missouri, Rehab Sciences Institute, Washington University, St. John's Rehab Research Program, and University of Toronto, and the study was published in January 2016. So the second article for theme 3, the purpose of this study was to investigate the effectiveness of compression bandaging from the finger to axilla and reducing post-stroke edema in the upper limb. The study used an ABA research design on a series of single case study participants, with repeated circumferential measurements recorded at 5 points along the hands and forearms. There are a total of 5 participants recruited from an inpatient ward, and the implications for OT are that compression bandaging of the entire upper limb may be an effective intervention option for reducing post-stroke edema, and that there is a need to carefully monitor edema before and after bandaging in each individual. Affiliations are the University of Queensland and Princess Alexandria Hospital, and this study was published in January 2016. So this was the OT practice article for theme 3, and it lists several key areas of focus for OTs to support stroke survivors in returning to work. Included are to address return to work early and consistently throughout all stages of recovery, provide education to both the client and their family regarding laws and regulations that protect workers' rights and vocational rehabilitation services, thoroughly advocate for needed services, and clearly document specific info regarding work during the occupational profile, complete a comprehensive job analysis addressing physical, cognitive, perceptual, psychosocial, and environmental needs, use occupational-based models, complete assessments for real-world work activities, and address executive functioning impairments, promote coping skills, especially regarding depression, involve employers, refer for driver evaluations, collaborate with VR services, and enhance practitioner competencies. So this is the first article for Theme 4, Mental Health, and the purpose of the article was to evaluate the evidence for practicing mindfulness to treat job burnout and the implications for OT. The method was a systematic review using articles that were published in a peer-reviewed journal, randomized control studies written in English, and involved participants 18 years or older that reported workplace burnout but were otherwise healthy, used mindfulness training for at least half the intervention, and were published after 2004. The implications for OT are that practitioners should be aware of their own risk factors for developing burnout, use objective measures to assess their own levels of burnout, and practice mindfulness by reading books and using websites, watching tutorials, attending local groups, and enrolling in a course, and also that research is warranted in this area as it relates to worker role participation, job performance, and client satisfaction with care outcomes. Affiliations are Guthrie Ambulatory Healthcare Center and Bain Jones Army Community Hospital, and this article was published in January of 2006. So this is the second article for Theme 4, and the purpose of this study was to investigate dual task performance on cognitive and hand dexterity and the relationship to daily functioning in schizophrenic and healthy control participants. The design was having the participants perform the Purdue Pegboard and the Serial 7 subtraction test under single and dual task conditions. There are 16 patients with schizophrenia being treated at a psych clinic and daycare rehab, and 16 matched healthy volunteers. The implications for OT are that people with schizophrenia, dual task performance may assist in designing intervention programs, task simplification can improve hand dexterity, and utilizing this method might promote ADL function. Affiliations are the National Taiwan University and Hospital and National Cheng Kung University and Hospital, and this article was published in April 2015.
For Mental Health, Article 3, the purpose of this study was to replicate and extend previous findings regarding interrelationships among attachment and sensory variables to inform clinical approaches and guide future research. The design of this study was cross-sectional. The sample population was 116 healthy participants who completed questionnaires before participating in a cold pressor pain inducement test. The implications for OT were that the person may feel more compromised in therapy. It alerts practitioners to possible relationship-based or sensory-informed therapeutic approaches, and working with one domain may improve outcomes in all three interrelated domains. The affiliation is University of Queensland.
The purpose of this study was to explore the research on interventions that can help children and youth with diabetes learn to manage their own condition. The design of the study was a scoping lit review that followed a series of steps, including asking the research question, what interventions increase self-management skills with children and youth with diabetes? 11 studies were looked at that include children and youth with either type 1 or type 2 diabetes. They range from 8 to 19 years in age, with most being over the age of 14. Implications for OT were that they can play an important role in helping to assess children's motor, process, communication, and interaction skills, and make recommendations about self-management that matches the needs of the individual. The affiliations were Midwestern University. This study attempted to identify the risk factors for children ages 3 to 15 who are all overweight and obese. It also identifies the potential relationship between childhood obesity and functional limitations, as well as examine the different enjoyment of physical activity between children who are obese or children who are healthy. The design of this survey was a cross-sectional design that was used to investigate the potential risk factors from looking at data from a National Health Nutrition Survey and through interviews with children who are overweight and their parents. The average age of participants was 9. The prevalence of obesity was found to be higher in boys, and adolescents had a higher prevalence than mid and early childhood. The implications from this study are that healthcare practitioners should provide the recommended levels of 60 minutes daily of physical exercise. Also, healthcare practitioners should consider internal and external factors that interfere with physical activity. Children are more likely to participate in physical activity if there is support to help them deal with barriers. The affiliations for the study are the Medical University of South Carolina. This study examined the child, family, and environmental factors that facilitate or hinder participation in health-promoting physical activity, HPPA, among children who use assistive mobility devices. This was a scoping literature review using multiple databases. It looked at child factors that affected health-promoting physical activity participation. It included the child's physical level of functioning. Implications for OT were that they have a role in providing health-promoting physical activity as part of a healthy lifestyle. OT practitioners can evaluate, modify, and support the child's environmental factors to enhance health-promoting physical factors. Organizations and population-based interventions are useful in promoting healthy physical activity. The affiliation for the study is University of Washington. The goal of the study was to explore the impact of changes in habits and routines, task behaviors, and engagement in daily occupations resulting from an occupational-centered community program that focused on childhood obesity. A mixed sequential experimental design was used in the study. Participants included 10 children between the ages 8, 9, and 10. Patients reported that the program had a positive effect on daily activities. Implications for occupational therapy practitioners were that community-based programs can affect daily habits and routines of youth. Enabling youth with easy, practical ideas can encourage them and include health-promoting occupations in their daily lives. The affiliation for the study is Loma Linda University. This study aimed to implement and examine the benefits of a culturally relevant health promotion in family routines. It was a 16-week program which used an evidence-based curriculum. This study used a pre-assessment, post-assessment design with a follow-up to determine goal achievement. 17 families participated in this study, all having children with disabilities. Implications for OT practitioners: they should consider collaborating with other professionals who can help deliver interventions bilingually. Practitioners also are encouraged to work with families when designing interventions to include their cultural relevance. Also, practitioners should engage with diverse communities. The affiliation for this study is University of Illinois at Chicago.
For Pediatrics Article 1, the purpose of this study was to describe the prevalence and type of sensory processing differences in children born very preterm and determine any associated neonatal risk factors. The design of the study was an assessment of sensory processing patterns using the short sensory profile in a retrospective cohort. The sample population were children 4.5 years of age born very preterm at less than or equal to 32 weeks gestational age. For the implications of OT, given the high prevalence of sensory processing differences in children born very preterm and experiencing difficulties in the performance of daily occupations, referral to OT would be appropriate, as they offer a unique perspective on the delivery of service to children with these difficulties. The affiliations are University of British Columbia Children's and Women's Hospitals, and Child and Family Research Institute. For Pediatrics Article 2, the purpose of this study was to examine ADL functioning and health-related quality of life among youth and young adult survivors of childhood brain tumors. The design of the study was cross-sectional. The sample population was a convenient sample of 36 survivors of childhood brain tumors recruited from a long-term follow-up clinic at St. Justine University Hospital Center in Montreal. The implications for OT were using objective performance-based measures to gain a more comprehensive understanding performance of ADLs in survivors of childhood cancer. Timely evaluation and intervention could help achieve optimal independence, participation, and health-related quality of life. Increased awareness of the potential for functional limitations of brain tumor survivors may increase access and utilization of services. The affiliations are Montreal Center for Interdisciplinary Research in Rehabilitation, Jewish Rehabilitation Hospital Research Site, St. Justine University Hospital Center, and McGill University. For Pediatrics Article 3, the purpose of this study was to investigate the progression of head lag in preterm infants in neonatal intensive care unit hospitalization, identify the medical factors that may contribute to head lag, and explore the relationships between head lag and neurodevelopmental outcome. The design was a prospective longitudinal study. The sample population were 64 participants born less than or equal to 30 weeks estimated gestational age and were enrolled in the study within the first 72 hours of life. The implications for OT were the presence of head lag, decreases with advancing postmenstrual age, being related to medical complications in the neonatal period to cerebral injury, early neurobehavior but not to neurodevelopmental outcome at 2 years of age, and providing clinical information that can support use of early therapeutic interventions. The affiliations are University of Texas Medical Branch, Washington University School of Medicine, and Brigham and Women's Infant Hospital. For Pediatrics Article 4, the purpose of this study was to determine whether FM devices are associated with improved academic outcomes in children and adolescents ages 5 to 21 with auditory processing concerns but without primary hearing impairments to support evidence-based practice. The design of the study was a systematic review. The sample population was 211 participants, 187 with auditory processing impairments and 24 control participants without auditory processing impairments. The implications for OT are FM technology is an evidence-based strategy to help children function in their school setting, to support device use at team meetings, and to work as part of a larger team of school-based professionals in an interdisciplinary collaboration. The affiliations are Virginia Commonwealth University, Sacred Heart University, and Temple University.
Go.
So for the first article for productive aging, the purpose was to gain a better understanding of how vision, loss, and comorbid chronic conditions influence occupational performance. For the design, a mixed method design was used using qualitative approaches. For the sample population, 59 OTs completed the survey. The client interview composed of 8 white older adults with age-related macular degeneration. For the implications for OT, OTs provided intervention in the client's home environment, they screened clients for depression, collaborated and referred the clients to other rehabilitation providers, particularly mental health professionals, solicited and enhanced caregiver implementation, addressed both vision loss and comorbidities to enhance safety, expect deficits in ADLs, IADLs, social participation, leisure, and work, apply compensatory strategies that include environment, modifications, adaptive equipment, and modifications of habit and routines. For the affiliation, the University of Alabama at Binghamton was affiliated.
Go.
So for the second article for productive aging, the purpose is to examine differences in observed IADL performance, self-performance, and satisfaction in performing life roles between people with an MCI and healthy participants. For the design, a cross-sectional design was used. For the sample, 7 were in the MCI group and 5 were in the control group. All the participants were white. For the implications for OT, the OT can advocate to be part of the team and use evidence-based assessments that could build on client strengths in independence and safety while seeking to compensate for errors in adequacy to facilitate maximum occupational performance. For the affiliation, the University of Oklahoma and the University of Pittsburgh were affiliated. Third article for productive aging, the purpose is to evaluate the accuracy of clinician and caregiver ratings of driving fitness compared with a standardized measure of road tests, performance, and extended on-road videos, recordings of a natural driving behavior. For the design, conducted an observational study of performance on a formal standardized on-road test and naturalistic driving behavior in older adults with cognitive impairment. For the sample population, 75 drivers participated with mild to moderate AD, who were ages 60 to 89 years old. For implications for OT, OTs use a valid and reliable questionnaire of driving ability that address specific ratings of driving behaviors. Also, the validity of family member reports for driving ability may be weak, so gather input from multiple family members. Finally, programs should help caregivers recognize and monitor unsafe driving behaviors. For affiliations, we have the Rhode Island Hospital and Alpert Medical School of Brown University.
Go.
So for the fourth article for productive aging, the purpose is to compare environmental barriers, housing accessibility, and usability in dwellings before and after relocation among very old single living people in the community. For the design, data was analyzed using a before and after design. For the sample included 80 to 89-year-old Swedish participants that lived alone in urban communities, and the final sample included 29 participants. For the implications for OTs enable older adults to change appropriate dwellings regarding availability, usability, and usability. They widen the scope of having modification services to housing counseling and understand stable accessibility against the background of increasing functional limitation among community living very old people as a positive outcome of relocation. Also, they demonstrate the value of standardized assessments. For the affiliations, we have One University and Goethe University.
Yeah.
So for the fifth article for productive aging, the purpose and design of this study is the study used an improvised experimental methodology to examine how varying levels of operational and tactical driving tasks demands might differently affect message recall for older adults with MCI versus a group of age-matched, healthy control participants. For the sample population, both groups had 12 participants each. Two groups that did not differ significantly on age, driving experience, driving exposure, education, total accidents, and accidents in the past 2 years. For the implications of OT, self-reported global changes in driving is important for practitioners to consider. Use of interactive driving simulators in clinical settings with clients as a screening tool or assessment tool. The use of memory tasks and increased demands on relative straight roads will allow clinicians to use the simulator with more clients. For affiliations, we have the National Technical University of Athens, the East Carolina University, the University of Athens, Greece, and National and Kaptoldistrian University of Athens. So for the sixth and final article for productive aging, the purpose is to determine whether age affects the manifestation by using the brief test of the NHT toolbox and to compare age-related data. The design focused on functional meanings of touch perception based on the NHT toolbox standards, and also included measuring of tactile sensation and discrimination, proprioception, and hepatic object recognition. For the sample, there were 367 participants aged 3 to 85 years old. For implications, the NHT toolbox may be useful for OTs in evaluating somatosensory proprioception, and touch perception varies with age. Clinicians and research must consider age-related expected performance. Touch perception is highest in young adults and lowest in young children, older adults. Touch perception is also viable between the ages of 3 and 5 years old. For affiliation, we have Northwestern University, University of Kansas, McMaster University, Ohio State, Thomas Jefferson University, University of Alabama, MGH University, and La Trobe University.
The purpose of my first study was to provide an update to a previous review by summarizing articles published between 2006 and July 2014 related to the focus question. The design was a systematic review that included a search that resulted in a total of 5,139 records. The final result was 513 records, of which 409 were unique. The OT implications include full-time splinting combined with stretching, tendon, or nerve gliding activities for patients with carpal tunnel syndrome, exercise and early motion activity after a distal radius fracture, splinting recommendations for patients with swan neck deformities and mallet finger to improve functional activities, and a need for research in this area to support the value of occupational therapy. The affiliation is the University of Southern California. The purpose of my second study was to evaluate the current evidence for interventions within the occupational therapy scope of practice that address pain reduction and increase participation in functional activities. The design was a systematic review that included a search that resulted in 5,139 references that address the focus question. The OT implications include occupational therapy practitioners incorporating preparatory interventions when providing treatment to people with musculoskeletal disorders to decrease pain and increase function. Evidence for ultrasound and radio shockwave therapy is moderate. Further research is required to measure functional outcomes of combined preparatory interventions with occupation-based interventions, and evidence-based interventions in this review are specific to musculoskeletal disorders and specific intervention recommendations.
The affiliations are Rocky Mountain University and University of Southern California. The purpose of my third study was to examine the literature published between 1995 and July 2014 that investigated the effectiveness of occupational therapy interventions for lower extremity musculoskeletal disorders. The design was a systematic review that included 10,533 total search results, 849 unique records, and 218 abstracts met inclusion criteria. The OT implications include multidisciplinary rehabilitation for hip replacement and knee replacement being effective when provided in inpatient or home-based settings. Multidisciplinary rehabilitation on teams can benefit people with lower extremity amputation or limb loss. Occupational therapy practitioners should consider using activity pacing as an intervention for adults with lower extremity osteoarthritis. And the study points to the need for further research in investigating the effectiveness of occupational therapy interventions for lower extremity musculoskeletal disorders. The affiliation was Ithaca College. The purpose of my fourth study was to evaluate the efficacy of occupational therapy-related interventions for adults with rheumatoid arthritis. The design was a systematic review that examined 51 Level 1 studies published from 2000 to 2014. Interventions focused solely on the upper or lower extremities were not included. The OT implications include OT practitioners being mindful of each person's disease and plan around flare-ups. Strong evidence supports OT practitioners incorporating exercise approaches such as coaching, home exercise, aquatic exercise, general strength training, or aerobic exercise. Practitioners can use a variety of psychoeducational interventions to improve function, fatigue, depression, and self-efficacy. And practitioners should keep in mind the power of self-efficacy. The affiliation was the University of New Mexico. So my fifth study was to identify the new factors associated with success in occupational rehab, such as intensity and activities. The design was a retrospective cohort study with 95 clients in general occupational rehab and 71 in a comprehensive occupational rehab. The OT implications include occupational therapists should provide an intensive rehab program with multiple components. Participation in simulated work activities is a strong predictor of successful occupational rehab. Intensity of therapy is an important consideration, and additional large-scale prospective research is needed. The affiliation is the University of Southern California.